the cost of healthcare concerns us all, but I think in our case, and I think a lot of cases when I talk to CEOs, it's not just the dollar cost, it's are we getting what we want for our employees with that, or are they getting what they want, more importantly? And so as we think about cost, it is something we try to manage, but the real question is, are we paying for more than we're getting? And are our teammates satisfied with it? So it is the number one concern because it keeps increasing, and we've addressed that various ways, including passing no cost increases through to the employees are paid in the lower part of the spectrum of our company, and passing higher increases to insulate that group, which is a higher percentage of the compensation, from having to pay more. Now the reality of that is that's helpful, but we still got to manage the overall cost down, but really got to manage the overall effectiveness up. Just in the last couple of years, we adopted a strategy around health screening, biometric screening. So, and we said to employees, we would like you to get the screening and figure out and work with health counselors after you get the screen to figure out what you can do to continue to make yourself healthier and maybe help with some chronic diseases and things like that. And so what we did is we gave our teammates $500 to deposit to their health care cost, against their health care cost, if they take the screening. And 90% of the people have taken it. And there are single cases, and a single case doesn't make it worthwhile, but the outcome of this case, where we found employees had serious issues that were able to take care of them right away, that the outcome of that a few weeks later was very unknown, and that's just a spectacular outcome for that teammate. It also gives everybody, geez, this is a great idea. The time is right to really sit there and say, can we, across 30 and 40 years, change this? Not 30 and 40 days. And so we can all make these incremental changes that we've all made. We can continue the wellness plan, but the question is really, with long-term thinking, how do we drive to a long-term change? And I think the benefit of having the best thinking of great CEOs and great practitioners and great technologists and great innovators all in a room together and all in a council and bringing the issues to fore is that you can create 30, 40-year horizon differences while you're still focused on the day-to-day, and the combination, I think, will be significant. We ought to be able to create some solutions that will help corporate America, help our companies, and ultimately corporate America continue to work to get better outcomes for their associates or employees at lower cost over time. And if we do that, we'll help our companies, we'll help all of corporate America, and we'll help America ultimately. And so I think this is a great way to do it.